everyone, my name is Sarah Trottier, registered physiotherapist with focus on women's and pelvic health here in Ottawa, Ontario. Today I'm going to talk to you guys about the all ball. It's an air-filled ball about 4 inches wide that is used for tension release through scar tissue, through muscles, through fascia that can in the end cause pain. And I often recommend this ball for women who've had C-sections, any abdominal surgeries, or even endometriosis. And so I love using this ball because it's a lot smaller than our gorgeous ball that we also use. And the reason for that is that it can get into smaller areas. So if you have a specific incision that is really causing a lot of discomfort on one side or there's a lot of tension, this ball is perfect to release specific areas or into specific fascia into our organs. So what I typically recommend with this ball, you can't necessarily change much about the air content. So if it's really uncomfortable, I would definitely recommend going into a larger ball, so like the gorgeous ball. But this ball, like I said, is very useful for more specific areas. And so let's say you've had a C-section and there's a lot more tension on your left. This ball is awesome for that. So what you would do is you would take the ball, you can place it on the incision as long as it's healed, there's no infection, and you're at the time where your physiotherapist or your other healthcare practitioner said you're able to use and do some self-release. So you place the ball in the area of tension, and then you're going to lay on the ground on the ball. And so it's very useful having a nice yoga mat to soften things up a little bit. If it's still a little bit too much pressure, but you can tolerate it, you can always put a pillow, a blanket, a towel underneath as well. What this is going to look like is you can take your ball. I prefer it skin-on-skin contact, so what you would do is you could be in a nice smaller shirt, you could place it on the area, and then nice and gently lay on it on the stomach on a yoga mat. I usually start off on my forearms to kind of slowly sink into the pressure. And if you get to a point where it's causing a little bit of discomfort, but you can tolerate it, that's perfect. If it's too much discomfort, let off a little bit or put something underneath, like a pillow, a towel, or something softer. If you want a little bit more release, what you can do is you can slowly lay down on the ball. You can gently roll side to side if you feel comfortable with that. And you can even do some nice deep breathing into this position. And so I'll usually stay in one spot for about 2 minutes. And that's enough to get a little bit of release. And then you can kind of slide over, bring the ball a little bit more into the middle, and then do the exact same thing in that position.